Since March this year, the Health Ministry has been carrying out an unprecedented campaign to have almost half the country's population vaccinated against COVID-19. However, the ministry is still concerned about the low numbers of people so far inoculated, although there has been an increase in the number of COVID-19 vaccines in the country. To enhance this, the ministry is now considering restricting access to public places for people who have yet to be vaccinated as part of efforts to drive up vaccination.
Given that we want to have a fully opened up economy, that is something that they would advise on. So you will find that you're not able to access public places after that decision has been taken.
Ainebyoona points out that the implementation of this idea rests with the Vaccination Advisory Committee, which is considering the matter.
It could be in the process based on the advice.
Then you talk about it, but are the vaccines available?
Yes, for now we have vaccines available. We have received over 5 million vaccines. So far, we are utilizing about 3 million vaccines.
In the meantime, it has already been decided that ministry staff who are not yet vaccinated will be barred from accessing the ministry's offices in the near future.
We are starting with the Ministry of Health to ensure that all staff are vaccinated to enable access. We must lead by example. Every staff of the Ministry of Health needs to be vaccinated because soon the access to the Ministry of Health will be based on vaccination.
Consequently, health workers leading the vaccination drive have been urged not to turn away people willing to be vaccinated, even when they don't fall in the set categories of essential workers. But Health Civil Society Organization SEHAD has warned that the ministry's proposal to enforce mandatory vaccination might be a violation of the country's laws.
If the Ministry of Health is coming up and restricting access of these offices to particular people or to the public, they have to prescribe it in law. There has to be some kind of regulation or some kind of statutory instrument that they put in place. But we also have to ask ourselves, is this the only option left? And there are other options that they can follow, to prevent the spread of COVID-19. For instance, if someone has followed all the SOPs, they're wearing their mask, they have sanitized, they have social distanced, is it still justifiable to restrict them from accessing an office?
The matter has raised the question of whether COVID-19 vaccination is mandatory or optional. Joyce Nakato, NTV 29.